Hi, I'm Melissa Cady, the owner of Painless Wellness, and I'm a board-certified anesthesiologist and board-certified pain medicine physician. I just want to give you a play-by-play of what to expect on the day of a nose procedure or rhinoplasty of any sort, whether I'm the one taking care of you or if I've assigned another trusted anesthesia colleague. They will call you from the surgery center the day before or the Friday before a Monday procedure to let you know what time to show up, typically 1 to 1.5 hours prior to the scheduled surgery time. They'll have you show up to the facility. Once they're ready to bring you back, they'll bring you into a pre-op area and they'll bring you into a bay where there's a curtain, and they'll draw that and go ahead and have you change out of your clothing. They'll give you a gown and they'll give you a bag for your belongings. They'll go ahead and check your blood pressure, heart rate, and whatnot, and then they'll go ahead and check the consent forms to verify that that is all accurate. And then they'll start a small IV. No big IV is necessary. It'll be anywhere along the arm typically. Now, with the procedure that day, before we get started, the surgeon will come say hi. Myself or another anesthesia colleague that will be in charge of you, or a nurse from the operating room will all come and say hello, make sure everything looks accurate, ask similar questions on purpose, make sure everything is consistent and accurate. Once we're ready to go back, either the nurse or the anesthesia provider will go ahead and give you a relaxing medicine through your IV that you already have. That'll help relax you. Most of the time you don't remember getting to the operating room, or like a weird dream. Once you're in the room, they'll get monitors on, let you breathe some oxygen, and then through the IV that you already have and where you received a relaxing medicine, additional medicine will be given to get you fully asleep. Once you're fully asleep and don't know what's going on, then a little breathing tube will be placed through the mouth between the vocal cords. While you're asleep, you won't know about it. I get questions all the time if you're going to be awake for that. Absolutely not. That breathing tube is placed, and that'll keep you safe from anything that might trickle to the back, such as blood from the surgery. During the procedure, the surgeon is really good about numbing up everything, so that's typically not an issue. On occasion, patients have other procedures done, and that'll just add to various areas that are covered with numbing medicine and different types of scenarios of bandages and whatnot. Anytime a rhinoplasty is done, depending on what the surgeon's agreed with the patient, the area of a rib harvest or an ear tissue harvest is possible, and those areas will be numbed up as well, bandages accordingly there as well. Once surgery is done, of course, the back of the airway area is suctioned out carefully and very gently to make sure anything in the back there is taken care of, so you don't have to worry about that. Then the breathing tube is removed before you're fully awake. The anesthesia is turned off. You'll wake up within 10 to 30 minutes. Most people are in recovery room 45 minutes to an hour after just a nose type procedure. If there's other things done or it's a longer procedure, of course, that can add some time. But most people are pretty quick to wake up. Anyone who's picking you up will get an update after we get started with surgery every 2 to 3 hours, depending on the length of the surgery, and then from the surgeon. And then the recovery room nurse will give a heads up, usually within 30 minutes of being ready to go, and discharge instructions can be given. Anti-nausea medicine is given before you even wake up. Anywhere from 3 to 4 anti-nausea medicines is pretty typical for painless wellness. Most anesthesia providers out there will give 1 or 2. The standard 2 are typically going to cover about 95% of patients. The 3 or 4 given in this case of my business is usually takes us to about 99% of patients don't have any nausea. So pretty rare to have any issues there. Really rare to have any pain after a nose procedure. On rare occasion, maybe a headache or a little area that's bothering you, and there will be orders for the nurse and recovery room to give you certain things based on what your needs or requests are. If you have any questions or things have come up during this explanation, feel free to ask your anesthesia provider who's assigned to you during your anesthesia consult. They'll be happy to answer those questions for you. And if you have any questions about whether or not you need a catheter, or, it really is patient dependent and pretty rare that we would ever have to use that for the 3 to 4 hour type window for just an isolated nose procedure. So that's not usually an issue. We'll just have you void before you go back to the operating room. So if you have any other questions, feel free to write them down and we'll be happy to answer them.